The third question, third pre-prepared question goes to Howard, and this one is short. Howard, what can we do for Nova Scotians living with mental illness?
Well, as long as we're talking about an aspect of the healthcare system, I have to say to Kenzie, it's going to be a surprise to Tommy Douglas in the 17 years of NDP government in Saskatchewan where they started Medicare that it was the Liberals who founded it. But moving right along to that aspect of the healthcare system, which is the mental health care system, let's say that right away that there are serious problems with the delivery of mental health care, particularly to what has shown to be the most vulnerable population, which is those in their late adolescence and early 20s. We know that there's been serious problems there. The admissions for attempted suicides at the IWK, meaning children under 17 or 18, have tripled over the last few years. We know that there's a crisis. We know that something serious has to be done. What our main proposal has been in this respect has been to say that we need to have in place all around the province what we have in Metro, which is a 24/7 mobile crisis team. Those mobile crisis teams I've actually seen in action. They're great, and they are available to families to come out when there is some kind of family crisis that involves a mental health problem, and they can come to your home and they are able to deliver the services on the spot. But in addition to that, we are wanting to improve all of the supports that are out there, including taking mental health supports into the schools where there's an attempt going to be made to have early identification of these problems. There's a whole range of other things, but I have to say that those two are probably the most important aspects of a transformed mental health care system in Nova Scotia. Thanks very much.
Kenzie.
You wouldn't expect me to pass up the opportunity to reply to Howard's comments about family Medicare. Medicare, the province, single province in Saskatchewan is pretty relevant to the complexity of setting up a national Medicare program funded by the federal government. The insidious thing about mental health, mental illness, is the effect it has on people. You know, it drives people into retreating from the public domain, and they lose their voice, and they do not seek out the kind of political commitment that other people. I mean, our newspapers and television and radios are full of advocate groups, people victims of certain illnesses or accidents asking for redress. The problem with mental health is that these people often lose their voice. They don't want to go public on these kinds of things. What we need, and what the Liberal platform has called for, is a mental health commission, where we have designated people who will speak on behalf of the mentally sick in Nova Scotia, seek out the kind of facilities that they require, the kind of program they require. I'm a family lawyer by day, and I know that family breakdown often leads to mental health problems, especially among children. And it's awful in Nova Scotia. A child who desperately needs mental health services, you can't get them. They just aren't available. And again, there's no spokespeople, there's no champion for these people demanding the kind of services that those people need, and which would so much improve their lives if they had them. So I think our proposal for a mental health commission is a really smart idea in addressing this need.
Thank you. Howard? Oh, sorry.
Jessica.
Jessica, sorry.
That's okay.
I knew I was going to start the debate.
How much I look like Howard?
No, we won't go there.
No, that's okay. No, this is an issue that's really close to my heart, because in being involved in homelessness, this is something you come across time and time and time again. But according to the, I forget the association's name, but they're sponsoring tonight, Mental Health Association, their own website says the very best solutions for the mentally ill are community connections. Is that when people struggle with mental illness, they need relationships. They need a circle of people around them that can help them with day-to-day issues as well as medical issues. In the work that I'm involved with, we've had success with permanently ending homelessness in people's lives by creating these connections and helping people with their taxes, getting the supports directed. I think that the best solutions are community solutions. Is there room for improvement in our healthcare system? Absolutely. But you have to remember that most of the problems that we're looking at goes back a generation to when individuals were deinstitutionalized. And that was a fabulous step forward in a way, because it was a far more humane solution to mental illness. You don't just shelve somebody in an institution at a cost of $200,000 per year to the taxpayer, and you kind of let them rot. There are more humane solutions now. The problem was that when these transitions were made, and it was not one party that was doing this, this was happening all across the country because it was a society decision that this is not how we're going to handle the mentally ill anymore. The problem was that what was needed in the community wasn't even known. All they knew is that we needed to move forward with deinstitutionalization.
Okay, thank you very much. Howard, you got 30 seconds.
Yeah, thanks. The point about deinstitutionalization is quite accurate. It was a North American phenomenon, and it goes back 30 years, but you can't deinstitutionalize the mentally ill without providing community supports for them, and that includes housing. Housing has, in every study, time after time, been shown to be the best support that someone who has a mental health problem could have, an appropriate form of housing. Unfortunately, under the Conservatives, we have seen cutbacks time after time of appropriate housing, and that has had a real impact on the community of the mentally ill. That has been, and that's had been problematic for the rest of the community at large. So
Okay.
we have to think, I think, a better alternative.
Your 30 seconds are up.